Okay, well, the numbers are rapidly rising. I think I'll go ahead and get started, though, just in the interest of time. We have such a fantastic program today. So welcome, everyone. We're really excited to be kicking off a series of three lunch and learn sessions on impact. This is kind of our like summer summer kind of content for all of you. My name is Rick Glazier. I'm the scientific director of the CIHR Institute of Health Services and Policy Research. I'm kind of co-organizing this particular session today with Meg McMahon, who needs no introduction to any of you. Meg is Associate Scientific Director at ISHPR and an amazing leader, visionary organizer for the Health System Impact Program over a sustained period of time. So just thrilled to be doing this with Meg today, and I'll introduce our experts and our present presenters today in a moment. But really just want to just welcome you all to this really exciting series. So we can have the next slide. So this is actually a three-part series. So we're starting today. The three-part series is focused on impact. It's hosted in partnership between us at ISHPR and the Health System Impact Training Platform that you all know so well. So this is organized together, and we're just thrilled to be able to do this together. So as you know, impact is a core feature of the Health System Impact Program. It's in the name. It's emphasized in the alignment of research to an organizational impact goal for the projects that you're all working on, and recognized, of course, as more than publications in metrics of success. So it's really about having an impact, making a difference. To support the impactful transition from fellowship to career, we've co-designed this new series to include sessions on impact narratives. So that's going to be the focus of today. Also a core element of your reporting. We have future sessions on communicating for impact with the media. And I've had the good fortune to participate in many similar sessions before that are absolutely fantastic. And then the one that seems to be super popular is on the new tri-agency narrative CV that I think we're all kind of wondering, how do we do this? What are the ideas? What are the directions? What are the tips and tricks for doing this new narrative CV, which is a pretty major change in the research environment and in our preparation for applying for funding. The dates and times are flagged on this slide. You'll see we've got like 3 weeks in a row, lots going on. Not everybody's going to be able to attend everything, but we're really, really excited about this and hope that many of you can attend multiple sessions. So before I introduce our guest experts for today, I'll start with a land acknowledgement. So I'm based in Toronto, and I would like to acknowledge and express gratitude for being able to live, work, and play on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. I would also like to pay respect to all First Nations, Inuit, and Métis peoples from coast to coast to coast, and for their past and ongoing contributions to our society. I invite you to share your own land acknowledgements in the chat, as we're all joining from different locations across the country. So next slide. So here's why we're really here. I'm really excited, and I just want to say how fortunate we are to be joined by internationally recognized health research by our two experts. We'll start with our health research impact expert, Eddie Nathan. I'll share briefly that Eddie currently works with the Conference Board of Canada, has made impressive and impactful contributions to the science and practice of impact assessment over the past 2 decades in Canada and internationally. He's helped us to adapt the HSITP impact narrative tool for the Health System Impact Program. So the narrative tool is actually Eddie's work, and we're just thrilled and delighted that he's able to talk to us about that today. Eddie, on behalf of ISHPR and our many partners, thank you for sharing your time and expertise with us again this year. We're also extremely fortunate to be joined by Dr. Faraz Khalid, who is an alum of the Health System Impact Fellowship, a medical doctor and senior policy analyst with the Government of Canada at Public Services and Procurement Canada. His end of fellowship impact narrative was impressive, and I'm grateful he's sharing his time with us today to share firsthand insights about how to create a compelling narrative and why it's valuable and important to do so. So these really brief introductions don't do justice to either Eddie or Faraz and their many contributions and achievements, but you have their bios in your package, and I'll encourage them to share personal introductions momentarily. Today's session, you'll see on the slide, is in four sections. We're almost through the context setting, and then we'll dive into the art and science of impact assessment and impact narratives with Eddie, hear from Faraz about his experience, and save time for your questions and reflections. So I've already introduced Meg, who really needs no introduction to this group at all. So I'm going to hand over to you, Meg, for a few words about impact reporting for the Health System Impact Program.
Okay, thanks so much, Rick.
And any other comments you'd like to make, Meg? Over to you.
Thank you, Rick. So nice to see everyone here today. Really appreciate you joining us in, hard to believe, but the tail end of summer vacation. I'll start with big thanks to Christine with the Health System Impact Training Platform and Rhonda on the ISHPR team for helping to design and host this series. And of course, to our special guests, I'll echo Rick's thanks. And I wanted to share, we really wanted to share congratulations with all of you. So this Impact series was designed with thinking around the end stage of the Health System Impact Program. So many of you in the room today are nearing the end of your doctoral fellowship or your postdoctoral fellowship. And we saw them from the registration list. Many of you are alum or at later stages of your career, and it's just fantastic to have you here today to have a conversation and some learning around the art and science of impact narratives. But congrats to those that are nearing the end of the fellowship. It's been a journey, and this is situated at the endpoint. So just to ground, Rick really talked about the importance of impact within the context of this fellowship, and that has really been your journey through the fellowship. So you articulated an impact goal with your host partner organization at the start. You've been working over the last year or 2 years on an embedded research program within a health system organization that is aligned to that organization's impact goal. You may have pursued academic publications and other traditional notions of impact, but you've also firsthand experienced that impact comes in many forms and shapes. And so the impact narrative is a tool that is a component of your end of grant reporting in this program that really aims to help you capture the many diverse forms of impact that you've advanced through your fellowship journey. And so this session today is to introduce you to what an impact narrative is, how it can be used, and why it's valuable to think through your pathways to impact and the impacts you achieved in your fellowship in order to be able to communicate those impacts for next steps in your career pathway. I think this is known to everybody in the room. You're very familiar with the program objectives, having gone through the program yourself or mentored others that have gone through the program. But what we don't often share in the funding opportunity or the presentations we've done before is the underlying program logic. And so I won't read it to you here. You'll receive a copy of the slides, but it's really grounded in a concept of integrated knowledge mobilization or knowledge translation, where the situation of embedded research is in closer proximity to those who stand to use it. There's greater collaboration and contribution of the needs, goals of the organization, and so an opportunity to more closely align research with the organizational and strategic aims of the health system organization. And so in doing so, greater likelihood of building trusted relationships, greater likelihood of understanding the contextual factors that may enhance or hinder the use of evidence in practice, and an ability to firsthand grow the culture of rapid learning and improvement within health system organizations. So it's said a little bit more eloquently in the text on the slide, but that's the underlying program logic, and speaks to the value of thinking through the impacts that you've contributed to with the supportive tool of something like an impact narrative. The impact narrative is grounded in the Canadian Health Services and Policy Research Impact Assessment Framework. This is a research impact assessment framework that is nested within the widely acclaimed Canadian Academy of Health Sciences Return on Research Investment Framework that Eddie played a key role in developing. The particular framework that we're using, the HSITP Impact Assessment Framework, is specific to the field of health services and policy research, and therefore particularly relevant to the context of the Health System Impact Program. So you can see the theory of change, the pathway to impact articulated on this slide. We'll pop a link into the chat so you can spend some time looking through it. And the impact narrative tool comes from directly within this framework. And so Eddie is the expert, and so I won't speak more to this. I will take this opportunity to hand the virtual mic over to the expert, and Eddie just sing out. Oh, I had one more slide. The broader context is that, as you all know, there is greater recognition within CIHR and globally that research impact means more than publications and grants and citation metrics. Certainly that's an important element of, but not the only dimension of impact. And so situated in the CIHR Act, you'll see that the creation of knowledge is emphasized, but so is its mobilization into real world benefit. And the new research excellence framework at CIHR, which you see on the right-hand side, speaks to many important domains of research impact that we haven't really focused on or talked a lot about in the past. And so the Health System Impact Program is a program that really embraces this diverse concept of research excellence and research impact. And the narrative tool is a supportive tool for you to help put together the pieces and be able to communicate your impact going forward. So over to you, Eddie, with many thanks, and just sing out when I can advance the slides.
Thanks very much, Meg, and thanks, Rick, and thanks to all of you for actually being here and listening to somebody come in and talk about research impact, which I know is not the thing you normally sign up for, although when you sign up for a research impact fellowship, you're probably going to have some of it. I am excited to be able to sort of guide through some of the background on research impact assessment. So if we go back a slide, Meg. I'm going to start by talking about what it means, why we have research impact assessment, and then why people do it, and then sort of work through and get you to the point where we can work through what it means to develop an impact narrative within this framework. So the first thing is, why bother with research impact assessment at all? And predominantly this comes out of the idea that there's an increasingly prevalent culture of accountability in research, particularly in health research. But there's also a need to improve on our impacts. And in Canada, we have a very strong approach to being able to develop knowledge translation and knowledge mobilization approaches, being impact driven in terms of thinking of how we might get further forward. We also have research impact assessment because there is a competitive research market. People have to make decisions on how they're going to decide what research they fund, what research they do, and being able to assess the impact is a way to try and help understand that market and where you make decisions. It also helps us showcase some of those impacts, and by the very process of doing it, we actually can bring together the people that you might need to further those impacts. So aligning the impact assessment with this concept of knowledge translation and knowledge mobilization. And so that's kind of this thing. We've got this Wikipedia approach to having citations needed for any policy development. And these are important things. We want to understand that there is research that underpins broader societal impact. And essentially it boils down to 4 reasons why people might do it. The first is this idea of advocacy, which is we've been doing research. We want to tell people about the amazing things we've done and the impact that it has. That way they'll see how valuable we are and want to make sure that we continue investing. Second is this concept of accountability, which is that somebody has made investments and we want to showcase that their investment was a wise one. You've put money in, you're getting things out of it. Third one is up at the top, and this is the idea of analysis. And this is being able to learn from the things that you are doing. How have we got to impact? Where are the impacts that we're seeing? What was the process that got us there? How can we do better at getting to the ones that we want to see more of? Being able to do impact assessment gets you to that point. And then finally, one which isn't used very much, is used occasionally, is the idea of allocation, which is we've got funding, we know what we want to do, what impacts we want to achieve with it. Where should we make investments? How can we use our impact assessment of what we've done in the past to make better investments to try and get the impacts we want to see in the future? Maybe we can go to the next slide. And so based on the idea of this, and this is all something that is good base thinking for when you're developing an impact narrative, is there are steps you can take in understanding how you approach your research impact assessment. First thing you want to know, that first principle, is why are we talking about this? What's the objective of having a research impact assessment? How does it fit with those 4 A's? Are we really interested in telling people the best thing we've done? Are we interested in learning from what we have? Once you've got an idea of what the thing you're trying to achieve is with it, you then go to that second step of, who is this for? What would impact mean to them? What would I need to talk to them about? How would I focus the information that I'm identifying to align my conversation with them around the impacts that they want to learn about and the impacts we've been able to achieve? Once you've got to them, you can start to think about what methods you might get to actually understand whether you had an impact or not. Who would you need to talk to? Who might have data? Where would that data sit? And then finally, you get into these last two steps, which are what's the structure you need to organize your findings. And so for an organization, it might be a catalog of impacts. You might be looking at your entire portfolio and decide, I want to catalog what types of impacts I have. For an individual in a fellowship, it's down the line of a narrative. How do I talk people through the impacts I've been able to have and how I've been able to be moving that forward and why my role was important in achieving those? And then finally, making sure that you can communicate those to people who need them. So back to the idea of who does that impact for, what does it mean to them, and how do you develop your narrative to make sure that you talk to the things that they really need. Impact assessment is not easy. It would be great just to be able to say, I can go out and talk to people and identify this thing happened in the world and therefore my work's really important. But there are some significant challenges that are often cited when people talk about impact in research. First one of those that I'm sure you'll have heard about is this concept of attribution. If you are doing fantastic work in a hospital setting, the chances that your work is the thing that changed the cardiovascular health outcomes of people entering and exiting the hospital is that it's not possible for you to be able to identify mine was this proportion of that change. So you are a contributing factor. You are not the entire attribution of the change in society and health and whatever those larger end impacts are. So we talk about the idea of trying to do contribution rather than attribution when we talk about this. Second one is this idea that is identifying winners. So we often talk about the good impacts that happen. We don't talk about necessarily the bad impacts. And we use impact assessment as a way to really just hone in on things that are great. And we don't necessarily have the capacity to be able to say, okay, well, what can we learn from it? So I think that's a real challenge that is often brought towards research impact assessment. Final, last couple of ones, what's quality? Different people have different ideas about what quality is, and CIHR are doing excellent work on research quality initiatives. Impact is aligned with that work. And then the final one is this idea of time lags, and I'm sure you will all come across this, which is that when you do something in the research world, when you have finished your research project is not when the impacts occur in society, in individuals. They are time lagged from the ability for your research to get to the people who need it, for them to make changes in how they behave, for those decisions to then affect others. There are lags in terms of how long it takes for the work that you do to get through. And you may see, if you look into this further, you'll see numbers like the 17-year time lag between research and impact in health. That is an estimate based on aggregate data. So that doesn't mean that whenever you do work in health research, you will have to wait 17 years for the impact. You may see things happen straight away. Things might happen whilst you're doing the work. But understanding that there are time lags and that you may be not at the stage where you'll be able to identify all of the impacts that are likely to occur. If we can go to the next slide. So as Meg mentioned, when you're thinking about impacts within the Impact Fellowship, this is based on the idea of the work that was done by HSITP. This is fantastic work looking at the initial Canadian Academy of Health Sciences Research Impact Framework and saying, what would it look like if we applied this specifically in health services and policy research? The original framework was for any kind of health research anywhere in Canada. And there was a need to contextualize it. And we've been able to update and build new context around different ways of thinking about this. And CIHR has done a really good job of being able to say, this is the structure of what you want to think about it. So they've looked at the top of the arrow there around the time for impact. So you can see there are different sorts of impacts that might occur. There might be short, there might be intermediate, there might be long term. There are ways in which those impacts arise. So you can start to understand your role in them. Those impacts might arise originally by being able to identify problems in a new way or thinking about how you invest in HSPR. And then you can start to produce the evidence and the conditions for that evidence to make a change. And then within the center here, this circular component, we're really looking at the fact that there are groups for whom impact is important and the implementation of evidence is important to deliver on the broader impact. And so that could be in policy, that could be in changing practices in the healthcare system, it could be in changing the processes that are used around approaches or individual behaviors. And so all the different components of the ways that you might change something that will lead to those broader impacts in health, in better health outcomes, in lower costs for the health system, in the quadruple aim, now quintuple aim approaches. Those are all things that arise from people changing the way they do things or changing the way that others should do things, so written changes in policy and procedures. And so that gives you an idea of how you go from the work that you do to there being broader change in systems. Go to the next slide. So based on this, HSITP did some great work on building the framework. And one of the things they wanted to do was to say, okay, well, we need to understand how somebody would build narratives. And narratives have been an important component of research impact systems around the world, where they are a way for us to move from traditional metrics, understanding people's ability to produce papers, whether those are in high impact journals, whether people have a good H index and other terrible indices in the citation indices, trying to say we want to have a better understanding of what impacts we've had and how we've got to them. Human stories are important. And so impact narratives are a combination of storytelling, being able to understand how you've gone from from starting in your work to changing the system, and combining that with evidence. And so in some places we used to call this idea with the evidence-based anecdote. So being able to say we can talk through give somebody a narrative structure of here's the story of how we've been able to achieve the impact, but underpinning that is all of the evidence that tells you you've done that. So it's not easy to then discount it as, well, you aren't really doing this. You've told us a story, the story's lovely, but realistically, we've got no idea whether it's happening. Impact narratives are built to underlie the story with quality evidence and citable evidence. So if we go to the next slide. And so impact narratives are important in terms of how we build them. And they're important because they shift this idea of indicators versus narratives. And narratives are very good for engaging people, helping them understand why work is important. Indicators are great for people who work in system change, who need to understand how entire systems move and change. But narratives help people understand why you would want change. They allow us to learn lessons in a different way than perhaps indicators and shifts in numbers do. And they provide a very solid way to be able to communicate impact in a way that humans understand. We do understand the idea that numbers get bigger and smaller, but often without any kind of denominator, they don't really mean a lot. But being able to talk through, this is what we were doing, here's the impact it had, here's why we were part of that change. That's a really important component for why narratives are built into systems. And broadly speaking, they're a logical collection of information. They rely on storytelling rather than just data sorting. They combine the qualitative and quantitative, and they really help people to understand what your impact process was. And in order to get to that, there's going to be three things you want to think about: the context for the work that you've been doing, the evidence of the impact that arises, and the narrative flow. So how have you told the story? So those three components are really important when building impact narratives. Go to the next slide. And having those impact narratives comes with benefits and drawbacks. So there are system level benefits and there are individual benefits, system level drawbacks, individual level drawbacks. System-wise, impact narratives can be very useful because they communicate what's happening in the system. They change the discussion from an entire system level conversation to communications around why that entire system level is important. They provide somebody with a clear logic of what the funding to impact approach is. So you can guide people through why it's important to use this funding and have these processes to get to what you wanted to. And also you can use the idea of suites of narratives to inform future activities. So you learn from having multiple narratives. Obviously, there are benefits to researchers. You can report on things that aren't necessarily considered the most important by the system. So you can move away from the idea that it's just publication based. They're not as reductive as perhaps quantitative indicators might be. So you can still actually talk through why this might be important to parts of society, for example. And you can talk about things that are very important, even when you have things that are less quantifiable, or you had very applied research that perhaps doesn't fit in with the quantifiable measures that normal research systems think about. So those are all the good side. Challenges, system-wise, it's difficult to analyze and work with in a way that perhaps numbers are not. It can be costly because you have to actually be able to produce all these narratives. They can be hard to compare, even with a single narrative structure, although that gets easier now that we have AI systems for comparison. You need a strong framework to make sure that your link to your existing performance system is linked to the narrative structure. So we can't just have narratives that are produced in one way and a system level comparison that's produced in a different way. You need a way to be able to link them. And you need something that allows you to do quality control. So how do we know that this narrative is actually delivered based on the evidence of what was actually happening? Researcher-wise, this is different. You've never had to do things this way. This is not how you're taught as academics to think about things, and I will talk about why it's really different to do this And the other thing is that it's very hard as researchers, and I am a researcher in my day job, it's often hard for us to know where things have actually gone. Our role often stops at the point where you've done the research, you've published the findings, and perhaps you've had a conversation with people at a conference around what it is. But actually, the impact of that is 2, 3, 4 people down the line. Your sphere of influence on those impacts decreases, and your knowledge of them decreases. It's considered a potentially heavy workload addition, although I will say, having had to write end of grant reports back sort of 10, 15, 20 years ago, it's not that heavy compared to some of the things we used to have to do. And generally, there is also a individual issue around being assessed on impact, because there is a fear that what it does is it says if my research is not impactful enough, it's not considered good. And impact is normally considered in a system level because we know that science doesn't always work. Research is not always going to produce the things that we want it to do, and the factors that are involved in delivering those impacts are often outside of the scope of the researcher. So there's a general fear, I think, about being assessed on impact. That doesn't mean that narratives can't be useful in helping understand how we get there and whether we got there. Okay, can we go to the next slide? And so here's one of the challenges for being an impact fellow. And this is from XKCD. So the idea being that if you are working in coding, you do amazing code, solve an impossible problem in really quick time. In academia, you'd be sorted, you'd be golden, you'd be doing loads of work out of it, you'd be doing lots of things, but you're not working in academia, you're an academic working in an organization, and you fixed the problem. And now you've got to go and fix more problems. And so here you're having to sit in both of these worlds. And this is a challenge, and it's one where your narratives are a good way to try and explain why that challenge is something that you're able to achieve. Next slide. So thinking about how you actually build your impact narratives, I'm going to talk you through the way that you think about it versus how you then write it. So I want you to think about it in a way that you've been trained, because that's helpful. You've been trained as a researcher to think about, what did I do? What did I find? What does that tell me? How do I relate that to the world? Start with your content, with your problem, identify your methods, identify your results, and then work through to your discussion. In this case, the first thing you want to think about is the causal pathway. So I've been involved in doing something, I got funding to do it, I had my expertise, I had other expertise that I brought into it. What were the processes we used? What did we produce? And then what does that production, when we produce something, what has that gone on to achieve? So understanding that helps you break down your research into how you got to impacts and whether they're occurring. And that can help you with the contribution component. So you can see, okay, well, I did these things. Second bit is identifying the context. So why is this something that was important in the first place? What impact could it have if we could play this out to the future and people started using this effectively? And what evidence would people need to have that there is something to use from this? What's the evidence that someone needs to use this? Why would they take this on board? Why would they use it outside your particular sphere? Then getting into identifying the evidence. So what is it that can showcase that I did something useful and somebody used it? So that could be academic publication. It could be people you've talked to. It could be somebody who came and requested something from you. There is some pathway that lets you see, I did something and other people started picking it up and using it. And then the impact side. Okay, well, based on that, what are we seeing in terms of real world change? Are there shifts in systems on the things that I've been trying to shift? And I don't think you need to be able to say this shift in system was entirely belonging to me. You could say this system is shifting and I was a really key component of that. So things went on, but mine was a component of making sure that shift happened. And so it was important, necessary, but not sufficient in order to make that shift. And that could be societal level, could be changes for individuals, could be health-based, it could be organizations shifting what they do and having changes in outcomes. And ideally, focusing on change that's happened rather than things that you expect to happen. Because the challenge with the expectation of things is that other factors can affect whether that will really happen or not. And so we don't want to get too far down the line of this is going to change how the system works. Let's try and look at, okay, well, what is shifting right now? So that's the impact component. So that's what I want to think about when you're thinking of building your impact narratives. That's the process and the structure. And all this content will be shared with you so you'll be able to see this and work through it when you develop. Next slide. So I'm going to give you an example from work that I did a few years back when I was a funder of research and I was working with the Ontario Sport Support Unit. And one of the things we did was he said, okay, we're going to fund a number of these projects that are useful to try and shift the way the system works in Ontario. And one of the ones we funded was this project called Clean Meds. And so we gave funding and said, what happens, this project was, what would happen if you gave core prescription drugs to individuals for free? So people who have trouble fulfilling their prescriptions because they can't afford them, what would happen if you gave them those drugs for free? So we funded that. Process was of doing that work, engaging with the different people involved in Ontario to say, okay, well, what should we learn from it? And then also talking to different people at the Ontario and federal government level about, okay, well, if we're going to learn this, maybe we can align this with the conversations that are going on around pharmacare. How would we identify what should be included in that process? So as that work was ongoing, there were outputs from it. So the findings from this work were then, and associated studies related to the work, were then presented to decision makers at the provincial and federal level. So we're going to take you through the process of understanding what the findings were and what it means when you provide these free prescriptions. And that helped not only get information in, but it helped to build relationships and meant that the Clean Meds team and provincial and federal decision makers were then more closely aligned so that when other questions arose, there was a place for these decision makers to go and find information. So it's not just the content, it's also the relationships. And so what was the outcome and the impact that we saw from that? Okay, so we saw that as they were enacting the OHIP Plus policy in Ontario to try and make sure that young people had access to free prescription drugs, there was evidence being brought in from Clean Meds. There was expertise being brought in from Clean Meds. In addition to that, there was also significant conversations going on in national pharmacare. And when they were looking for evidence, they were coming to the Clean Meds team and saying, okay, well, what would you need to do to build a set of a list of potential pharmaceutical prescription drugs that we would actually have as the basis for a national pharmacare program? How would we align that? How would we understand what's important? How would we make sure we understand the costs associated with them? And so that was another impact in terms of really shifting the way those policy discussions were going at the national pharmacare level. So that is how you might build the impact pathway. That tells you input, process, output, outcome. That tells you that kind of story level approach. I'm now going to go to the next slide and ask you to switch it round. Because when we want to actually build it, we want to move to the idea that the first thing that's most important to most people is the impact. And so I'm actually going to go and say, okay, well, the first thing we need to understand is the impact. And so this is an impact narrative for Clean Meds that I developed. So you can say, well, the work of Clean Meds study impacted health, healthcare costs, and healthcare policy. So we've got three things straight off that we can identify that there were significant changes in. So we can know that when participants in the study saw improved health outcomes and lower healthcare costs. So I can tell you what it meant in terms of people having better health and what it meant in terms of the cost to the system by having the Clean Meds approach. So we've got a direct link to impacts on health and healthcare costs. And then in addition to that, we've got the study and the findings and the researchers all informed and modified the thinking of both Ontario provincial government around OHIP Plus and national government, federal government around national pharmacare strategy. So we can identify evidence that says OHIP Plus was done differently and pharmacare thinking was done differently because of the work that was done within Clean Meds. So those are your big impact levels. Then to get into explaining why this is important is to say, this is an important issue that we really needed to address. And Ontario and Canada struggled with how to manage the cost of prescription drugs. And Ontario went down the process of saying, we're going to move to an OHIP Plus program. But OHIP Plus doesn't work without good evidence. And so how do you make sure you've got the evidence on that? Well, this study was built and designed to align the idea of providing prescription drugs for free with OHIP Plus's development. And so that led to close work between the team with decision makers and invited audiences for Ontario Premier, for the Ministry of Health, and for the National Pharmacare Council. So the specifics of how you got to those bigger, higher level impacts of health outcomes, lower healthcare costs, and health policy changes. And so that's the idea of what you want to do with your narrative, is to say, we want to understand the impact. That's the big thing up front that you want to talk about. And then you want to explain to people why it's important and how you got there. Okay, if we go to the next slide. I mentioned that it's important that narratives are a combination of storytelling and evidence. Here's the evidence. So I could have cited this directly in the impact. I didn't because of doing it in a PowerPoint, but you can directly cite this. I can show you the improved health and healthcare outcomes healthcare cost outcomes are directly identified in this first document, the effect of treatment adherence on distributing essential medicines. I can also say, well, okay, well, this is also really important because it's informing discussions around national pharmacare. And I can go directly to the documentation of the House of Commons Standing Committee on Health, where they brought in the Clean Meds team to talk about this. I can also identify why it's an important problem. It's not just me saying it. There's challenges that have been identified in the national news at CBC. There are challenges in Ontario where they've identified it in the Globe and Mail. And we know that there's something around what it is to understand the effect of universal public coverage. And so CMAJ has a great document that was produced around that. And then what does it mean to produce that list of essential medicines? Well, again, there is documentation directly produced from the Clean Meds and the Clean Meds team that says, here's what it means to build this, and here's what it means to test this and put it into practice. And so we can build the evidence base that says the impacts we've identified are linked to something that I can show you the pathway to get to. Okay, so go to the next slide. So you're being asked to do this within your own structures, and you essentially have a number of sections that you'll have to look at. The first thing is the impact summary, and that's really where you want to get to the idea of what is the key impact, the first thing up front, then into the component of why was that a problem, why did we need to address it, what was the impact goal, how was our work involved in that, and what were the other contexts that led to it. And so that's really the impact summary. That's much like the one I just showed you. In the impact soundbite, this is basically saying we had a goal, we had a statement, and we have a statement of what our impact is going to be, or what our impact was. So it's really cutting down that impact summary to what we're trying to achieve and what did we actually achieve. Section 3, we want to show that this is not just you talking about it. So there are quotes from you, but there are also quotes from your supervisors to really talk about what it meant for the work that you were doing and how did you get to that impact. Go to the next slide. And when you want to think about this, you want to think about things like the policy services, health services issue and the context. So why would people bring in a health system impact fellow? What was the goal of doing that? What were the specific goals for you? And what are the areas where you might need evidence in the organization? So really bringing in that rationale. You're looking at trying to do that. When you're thinking about collective action, it is really saying, why did we work together to get to an idea of what the most important issue was? How do we understand what it was together? How did we build a program of work that would address that? How did we understand what we should do within that program of work? And how did we go from having just an impact fellow who was doing the work to having a system that was receptive to it? Those are key components to think about when you're building that section. Next slide. You also want to have the conditions for evidence, and you'll be asked to think about what was done to generate and translate this evidence to support the organization's needs. So how did we build something that was then applicable in the organization, and how were we able to shift the organization's approach to actually use that information? And one excellent component to think about is, what did this mean in terms of the organization being able to do more of this in the future? Did they have capacity to then do things differently because you were in place to develop structures to allow them to do so, or even the way they think about things? And then into more of those sort of decision-making processes, what actually did you see change? What were the impacts that occurred in terms of the changes in policy, changes in the way that people worked? Were there programs or processes put in place? Did you develop something that then is used in multiple parts of the organization? That's a really important component about whether you've actually been able to inform those decision components. And then back into the idea of those references, building a way to say, I found this out because A, I did something, or B, I talked to someone and they identified this as happening. C, somebody wrote a new policy document and this is linked to the work that we did, and being able to just create the line of sight from the evidence to the things that you've talked about. Don't have to limit that to academic or peer-reviewed references. This is not what we're about. If there are academic references that relate to that, then great, but most of this is likely to be organizational shifts. So that's where we want to think about in terms of corroborating those impacts. Okay, go to the next slide. Summary is really important because what it does is it tells people how the pieces of your impact fit together. It needs to be something that's easy to see and understand, but it's also useful because you can use it elsewhere. You can take that impact summary and you can package it into your new narrative CV that you're going to be producing, or you can produce it and have it as part of a conversation when you're talking about new jobs, when you're thinking about how you talk about your work to other people. And it's great for ISHPR because it also lets them showcase the value of the fellowship as a whole, because they can start to pull out information from these for ISPR, for CIHR, to say this approach allows us to do things differently and create these kinds of impacts. Really simple to understand. And those 3 paragraphs talk about the impacts, talk about the problem, talk about how your work got to shifting that problem. But keep that in bold, start with your impacts. That is the thing that everybody is going to jump onto, be interested in. Start with that as the starting point of your impact narrative summary. Next slide. So it's great to hear it in terms of concept, but it's much easier to hear about it from somebody who's been through this process and had to do it, and also what it meant for them to actually go through the process. So I'm going to ask Firas to come and talk about his work now. And Firas, I'll let you talk through your slide, but then also maybe have a short conversation with you as well.
Thanks, Eddie. Really appreciate this. I hope everybody can hear me okay. I'm joining in through my phone at work because Zoom is not allowed where I am. I thought you shared a lot of helpful information about impact, and it made me rethink when I was preparing for this session of what I actually want to share. Initially, what I wanted to talk about is the story behind the impact of my fellowship at the Canadian Red Cross. It all started out with recognizing a problem, a gap. Like any good story, it starts with recognizing where the issue is at that you're trying to solve. For me, I'm taking a cue from one of your last slides about how to describe your narrative, is that the impact for my experience was really focused around culture shift, embedding research in systems and impacting policy decision making that will eventually down the line have an impact on vulnerable populations. So the focus was always for me on how can I utilize my 2 years with the Canadian Red Cross to create a culture shift in the ecosystem that we like to call international humanitarian aid. And the reason I say this is because I've worked a lot in this sector, and there was a problem that was nagging at me for so long, which is that we hear they want to use evidence, yet to influence decisions and improve outcomes for vulnerable populations that they're trying to serve, but yet they don't have the system to do so, or they don't know how to do so, and nor do they have the capacity to do so. So, when you're thinking about your impact narrative, that's really what grounded my storytelling around the impact that I had with CRC, is thinking about the issue at hand and the impact beyond the immediate deliverable that I was trying to do, which is that I knew that I wanted to think about developing a rapid evidence system. And what does that mean more practically and tangibly? It means that anybody who can come in, a decision maker from the field who has a pending question, I go back to your 4 A's: analysis, advocacy, accountability, and allocation, really is the center point of where people would ask for evidence because they're trying to analyze the issue that they have at hand. They're trying to advocate for the solution you're putting forward. They're trying to be accountable through using evidence to the funder donor money for humanitarian aid. And based on the evidence that we provide them, they're able to allocate resources accordingly. So those were the things that really centered my idea around how do we create impact in a short time frame and are able to describe that impact once we leave. So when I was drafting my impact narrative, I kept focusing on vulnerable populations. I kept focusing on the culture shift, the impact of the culture shift that was created. And I learned a lot from it. I learned lessons in writing that impact narrative now that has really carried me further in my career. I'm going to stop here because I can go on for forever about my fellowship, and I recognize the time. So I'll turn it back to you, Eddie.
Yeah, so for us, one thing I'm interested to know is, when you were trying to start building the impact narrative, what was it? What was the focus for you that really let you think about this in a different way than perhaps you've written academic publications before?
That's a really good question. So I knew, we keep talking about impact in general terms. So if you want to go away from academia and all of Eddie's great slides, and you just want to talk about impact on a more relatable term, think about sitting with a friend having a drink, is the way I thought about it.
Mm-hmm.
I want to leave people feeling better than when I first start talking to them. So if a friend is going through a problem and I'm sitting there listening to their problem, I want to be able to walk away from this, both of us feeling better about how we solved the problem and what the issues were. And I approached my narrative the same way. I thought, think of CRC as the boyfriend or girlfriend or partner who has an issue. I'm the friend they're coming to. We're sitting down talking about it. How do we get to feel better towards the end of it? And I build my narrative from that. So I start thinking about impact in more simple terms, like tangibly, I was there for 2 years. What are some of the impacts that I've created beyond a publication? You notice that I've never mentioned publication, and we did publish the work that we did at the Canadian Red Cross. We actually developed an evidence summary template that's now being used by many other organizations that function within the ecosystem of humanitarian aid and beyond. That's not been the impact for me. I hardly talked about the publication. What I actually talked about, my impact, was how the work that you do in making a culture shift at an organization that can sometimes be resistant to change because of policy legacies, um, how that impact can create strengthen internal capacity, people that work within it, can build lasting systems and relationships that support ongoing evidence use beyond me. I love something you said and I wrote it down. I'm just one screw in the massive wheel, right? Like, I'm not the one that created the impact. I was part of the impact and maybe the catalyst to get it started and moving in its full force momentum. And one of the most beautiful things, and I wish Celine was on the call, who was my Canadian Red Cross supervisor. I still get emails years now since my fellowship concluded, where the impact that we've created in creating a culture shift in a system that people are more likely to use evidence is happening. People are still requesting evidence summaries. People are believing more in the need for evidence to inform decision making. Also, the idea of embedded research is becoming very much a cornerstone of Canadian Red Cross. So the impact was beyond my work on evidence summaries. It was really about multiple other things. And one key part of them is the importance of having embedded researchers who can support decision makers in addressing their questions.
And I think that's a really important component for all of you to think about, which is that the things you learn will go far beyond your timing of writing this impact narrative. You will see impacts arise further down the line. And if you have this narrative, you have it structured, you have it built, it helps you understand how to bring that into further conversations. So I think that's a really important component to be able to say, okay, well, this was my snapshot at this particular moment. But actually, when I'm talking about this in the future, I'll be able to say, okay, well, I did great work on networking, but also that thing we built that we thought was just useful internally is now used in 15 different other organizations. That is not something we anticipated, but is now a big change to how the entire system is moving forward. And so I think those are important things that you may not have knowledge of that at the time, but as you build over in your careers, these are things that you'll know and you'll be able to bring, because you've got that impact mindset, bring those to your future conversations. So I think there's a significant benefit for individuals in the fellowship as well to be able to take this and use it forward. And for us, it sounds like you're already, you've been able to leverage the learnings from this, but also the learnings for you in terms of describing the impact, talking through the components, how that's relational into all of the things that you've been able to do since that point.
I mean, you just gave me an aha moment. I actually got goosebumps as you were talking, and this might be a bit controversial, but Eddie, I was thinking, wouldn't it be interesting if, and maybe you've come across this, if you write a proposed impact narrative before your fellowship, which we kind of do when we submit the applications, and then you compare your impact narrative at the end, which an exercise I haven't really done because we go into these fellowships, whatever they are, everybody's brilliant, everybody has great ideas of what they want to achieve. But I wonder if we actually spend more time, for me, I'll speak for myself, if I actually spend more time thinking, oh, what I really want my impact, like when I'm done with this fellowship, when I look back at my 2 years, I really want to strengthen internal capacity. I want more people at the organization I'm embedded in to be able to do the work that I've been trained in my PhD for 4 years to do on their own. Like, that would be a beautiful thing for me to do. I didn't have that insight into my impact because I didn't give myself the space to sit down and actually think about it concretely. So now I'm thinking one of the things, advice for anybody who's going to listen to this, if this recording gets shared, is that think about your impact before you start the fellowship, halfway through the fellowship, and the end. I don't think I wrote it at the end, but I don't think it should be written at the end. I think it should be written throughout your fellowship because it's going to help guide the way you're gonna, my first year, my fellowship, I was focused so much on building the systems. It was only towards the second year of my fellowship that I thought, oh, I really want to think about impact in terms of internal capacity, strengthening internal capacity. I wonder if I actually started my reflection earlier, I could have done two side by side. I don't know if that makes any sense, but it's just a thought I had when you were talking.
Interesting point. I know I'm conscious I want to have some time for questions. Maybe if we go to the next slide, we've got a space for discussion. And I don't know how you want to manage this.
I'm just going to pull down the slides for a minute so we can see everybody's faces. Let's see what's coming next. Okay, what do we do with impact narratives, the utility? Okay, we can come back to these. So let's pull these down and have a bit of a conversation. Start with Eddie. I learn something new every time you present this, so thank you so much for joining us today. And for us, yours is such a beautiful example of impacts at multiple levels. And so really appreciate you joining and lasting impacts. Like that quote from your system mentor about fundamental lasting change within Canadian Red Cross with spillover effects to other organizations is pretty incredible. So thank you for joining us today to share. I also really like your pre-post idea. And you've been an advocate of reflection for several years within the context of the fellowship. So thank you for bringing that back today. Let's go to the Q&A for some questions. And we will likely book another time to carry on this conversation, as an hour was clearly not long enough. So let's start with Joa. Do you want to come off mute, or would you like me to read it? Okay, I will read. Okay, so we learned from you, Eddie, that science doesn't always work the way we intend, which is very true, and that we're contributing to a broader, health system level impact. How can we tell our storytelling versus the narrative, especially for newer methods to do things where change is not appreciated as something for the longer term? This especially plays into the short-term 1-year framing timeframe of the health system impact fellowship.
Yeah, I mean, I think that I'll provide a bit of an example here, but that relational component is a really important component of what the impact is in those situations. You haven't got something that is plug and play and is now making change within a year, but what you've got is a way of changing people's behavior and changing people's activity and their mindset that allows people to do things differently. And so having that idea of where do I fit in that, I've done something, here's my process, what are the outputs I've been able to produce, what are the outcomes? It may be that the outcome so far is I've been working with lots of different people and they're all now thinking differently. They've engaged with me on something that they would never have engaged on before. That is an impact in itself, but it is also going to lead to further future impacts. So further down the line, you will get to a point where you can start to say, okay, well, actually, because they are doing these things differently, we're going to see shifts in these other areas. I think when you talk about the impact narrative, you can identify that this is the anticipated broader long impact, but focus on, to get to that, we've had to build relationships that were never there before. We've had to build trust that wasn't there before. This is what the really important component of this was, and there would be no shifts towards that longer term impact if we didn't have that part. And so I think there's ways to bring the relational components that you've had, the base building, that setting the foundation, those are all important parts of how you get to where you want to get to.
Thanks, Eddie. Great comment. Let's go to one around engaging and final users in the creation of the impact narrative. So any suggestions you have around doing so, including patients, families, caregivers, organizations, et cetera, as sometimes the things that we as researchers believe are impactful are not necessarily the things that are most impactful to those who stand to benefit or use the research. And certainly everyone in the room is aware that the intent is that the impact narrative is a joint view on impact from you, your health system, and your academic mentor. But I think this comment really shows that there are likely broader perspectives that could contribute to the impact narrative. So any thoughts you have on that, Eddie?
Yeah, for sure. I mean, I think one of the really important things here is when you think about impact, you're starting that from the process of developing your work. When I talked about the research impact assessment approach as a general approach, it really is about how do we make sure we're answering the questions that are most important to different people in the system. And by building those relationships, and Veronica made a great response there, which is that people want to talk to you about this. In general, if you're working with somebody, they will happily tell you, this was useful, this was not useful. Having those relationships and being able to have those conversations on a regular basis, not just at the end point when you need to write a narrative, is an important way of building up how you know if that's happening. And then you can go to people at the end and say, well, I've got to write something about this. If you were going to give me like a quote, what would your quote be? Those are the things that you can do, having built up that relationship. But it's an important thing to do all the way through. And this is why I think, Francis' point about thinking about it at the start, thinking about it as you're doing it, thinking about it at the end is all an important component of making sure not only that you're able to talk about the impact, but honestly that you deliver on the right one. Like you will change how you do things if you have conversations halfway through and someone says, actually, that's not really useful. I can't do anything with that. My context doesn't let me. So those are important things to build throughout the process. And I'm sure that because you're embedded, you're probably doing a bunch of that already. You just have never been a way of thinking that, oh, that's how I build this into my structural, my reporting at the end.
Can I just add to that? Actually, I love that because one thing I wrote down was checkpoint. So I drove my academic and my health system partner supervisors crazy because I would continuously have it in my agenda. We met almost every month, and one line in my agenda was not necessarily, I didn't call it impact, but I called it change because I was thinking about a lot about change management and like how do I change a culture? How do I change a system? And I love what Eddie just said because it's exactly that, prompting the conversation throughout your fellowship of being like, are we getting at the end goal of what we hope the impact will be from this 2 years together? And it allowed us to steer gear, like we changed direction throughout. And when it came to give the quotes, I'll just end at that, from both my supervisors, when I asked them to write their quotes, it was very easy for them because we've had this conversation over 2 years. And so they knew that, like, oh yes, of course, we continued the chats. And even since I finished my fellowship, I still have a very good relationship with them. We are still talking about the impact that we kept talking about through the 2 years. So that's an advice for anybody who's like, when you meet with your supervisors, actually have an agenda item, impact, like what am I trying to get out of this? Are we getting to what we intended to do? Should we steer direction? Because sometimes we get so busy on like the publication, the day-to-day operations that we forget the larger picture.
Thanks for us. Matthew's just being mindful of time, 2 minutes. Brief comment to you, and then, or and then
I'm good.
I think I just wanted to highlight that the impact narrative is important. Who are you writing the narrative for? So the element of writing the narrative that is really good for you and your supervisor and your institution or for the academic realm is one narrative. And the narrative that you're writing for a broader use, for the final user that may be benefiting on the long term, relating to that gap that you mentioned before, that your impact may take some time to actually have an impact. It's important to highlight. And also, engaging the right people when you're developing the project that you want to do on your fellowship. At least when I was in 2019, 2020 fellow, it was not part of the application process that you had to engage the final user on your development process. And the way that CIHR is adapting on the different SPOR models, funding models, and how those things are evolving, maybe engaging the user from the beginning all the way to the end, you can have a way better and more interesting narrative.
Thanks so much. Really great points. And absolutely, the hope is that you're talking about the impact goal with your health system organization from the get-go and co-creating that application together before it comes to peer review. So although you're not writing your impact narrative up front, you're certainly keeping the impact goal in mind and the pathways to impact. Really appreciate all the questions. I'm so sorry we didn't get to go through all of them. I'm going to hand the mic over to Rick for final last words with thanks to everyone.
Okay, wow, what a wonderful session. I've learned a ton. I've been inspired. Lots of nuanced thinking about impact here. That's really fantastic, and I think is tremendous food for thought. Many thanks to Eddie and Faraz. Amazing presentations and amazing participation and issues. My thanks also to Elena and Christine with the Health System Impact Training Platform for their collaboration. Thanks to all of you for your commitment and evidence-informed health system impact, your engagement throughout the program, and the impacts you're going to continue to make. This is not the end of your relationship with CIHR, the Health System Impact Platform. Please keep in touch. Learn more about HSPR impact assessment in the HSITP framework. And of course, we have sessions 2 and 3 coming up in the coming 2 weeks. So for the final slide, we'd love for you to take a picture of this QR code and take 1 or 2 minutes just to tell us about how this session went, what could be improved, share your feedback. We'll use it to plan additional sessions. And finally, there's one more link here to follow the Health System Impact Training Platform via their LinkedIn group, which you can see on here. Take another picture here. Thanks everyone. This has been amazing. And many thanks again to our presenters Thanks to everyone, and see you next Wednesday for Media Communications, which I know is also an amazing and fantastic session. Have a great rest of the day. Bye-bye, everyone.